Hello, everybody. Welcome into The Better Life with Dr. Pinkston. I'm Dr. Mariane Pinkston, and as always, trying to bring you some cutting-edge information to give you a better life. But, we're always looking to age well and live longer. And so, today, my guest is no exception, and actually somebody I truly admire very, very much. I've got Dr. Sam Fillinghane with me, who is clinical professor of medicine at William Carey University. But Dr. Fillinghane has done so much more. He's worked tirelessly for what I've known, 15, 20 years now, probably longer, but worked very tirelessly at trying to conquer cardiovascular disease, the number one killer of people in the United States. And I think that Dr. Fillinghane, I welcome you in. It's been wonderful to speak with you over the last, several months as we've been working on a new test. Well, it's not really new, but a new test of me called the MCG, Multifunctional Cardiogram. And welcome in. It's lovely to have you.
It's very nice to be here, Dr. Pinkston. Thank you for having me. I look forward to the conversation.
Oh, good. Well, I know this is at the cornerstone of your being, cardiovascular disease. So I will leave it to you to give us kind of an open view of what you do and what where you've been and kind of what we're going to talk about this morning at the MCG.
All right. Well, Dr. Pinkston, about 30 years ago, I had 3 patients that died back to back from cardiovascular events, and I had to watch it, and it was a horrible time. And so I decided then and there I was going to get better at this and prevention. And then lo and behold, after diving into everything I could get my hands on, dragging my family all over the country, stealing journals from the hospital lounge only to return them a few days later, and reading everything I could get my hands on, I came up with a different strategy. And that strategy allowed me to do something that happened unexpectedly. We started to see plaque reverse. So I was one of the first doctors in the country to have plaque reversal on his belt. And then I realized that what I was doing was so unique, I needed to begin sharing that. So I started teaching regionally and then nationally and so on. And I've spent about 25 years going around the country teaching quite a bit, just so I could hopefully get this in the hands of other physicians that could do it for their patients as well.
Absolutely, which is where I met you in learning advanced lipid studies. But so in that, how did you develop your love for all the disease states and all the things that you have put into, what you see as the concept of cardiovascular disease? There are so many disease states that are involved. So, you talked about plaque reversal, which is a huge statement. Plaque reversal. I think there's a lot of cardiologists that still don't believe that can be done, but it can. But you had mentioned, that there are 10 disease states that are involved in cardiovascular disease. So how did you develop all this and put all this together, and how can we apply it to our patients?
Well, years ago, I realized it was not just taking a statin and changing your diet a little bit and getting a little more active that was going to fix this disease, because everyone that was going down that pathway still went on to have cardiovascular events. But I studied deeper and found out that the real target was inflammation. Now, one of the things I keep teaching over and over and over across the country is if you aim for a target on your right side and the real target is on your left side, you'll never hit the real target because you're aiming in the absolute wrong direction. That's what we had been doing. And yes, initially I had a number of naysayers about plaque reversal, people that said it couldn't be done, but I had it in tens of patients, then I had it in hundreds of patients. Now I've had it in thousands of patients. I don't see people saying you can't do it anymore. I see people saying, I don't know how to do it, but that doesn't mean you can't do it. And I think they've realized through the literally thousands of patients that have successfully done it at my office and with angiographic evidence one time right after another, we no longer say that. Now, that being said, if the true basis of disease in cardiovascular system is inflammation, we need to understand how that works. And what we know about it right now is there's over 1,500 known cardiovascular inflammatory factors. There'll probably be many more discovered in the future. Of those inflammatory factors, they have some similar characteristics. They tend to circulate the bloodstream. They will be the initial entry into the blood vessel themselves. They secrete a chemical that's called a chemokine, and that chemical is what tends to attract LDL, which is the bad fat, to enter the blood vessel. LDL does not enter a blood vessel without an invitation. That invitation is the chemokine secreted by the inflammation. So I keep trying to teach physicians and trying to teach patients, the one who controls the inflammation wins. And so if you've got cardiovascular disease and you're listening to this program, you need to realize that there are 10 disease states that contribute the bulk of the inflammation that gets in your circulation. If you can gain control of them and add proper exercise to that regimen, you will be a very successful cardiovascular patient. You will see disease state reversal.
So true. So easy. Even a caveman can do it. Even Dr. Pinkston can do it. It is absolutely phenomenal, because when we are doing this testing called the multifunctional cardiogram and the MCG, which I perform in the office, I can actually watch patients get better. This is something that your primary care physician, as long as they're willing to, be open and concentrate on those inflammatory factors and all of these, 10 disease states, is something I can actually treat in office and reverse. And inflammation is at the basis of all disease, as far as I'm concerned, even mental health or, cancer or, diabetes, all these different issues, all of these play into your cardiovascular health.
Right.
Yeah, right. And so with, inflammatory disease, how can we actually, how can patients actually, discuss with their doctor, if they can't always come to me or doctors who are like me to perform this testing, but how can patients open up this subject to their doctors and then at home, read and try to take control of their own cardiovascular health?
Well, I think they could begin by learning the 10 disease states and say, doctor, I'm concerned about this inflammatory disease state that's in my body. Will you help me control it? And I understand it's at the basis of cardiovascular disease, and I want to win this war now. Your doctor may or may not understand it that way. You may still be a doctor that believes in statins and eating a little better and trying to exercise a little bit. You'll provoke him or her to think about what you said. They'll go back and study. And once you actually dig down deep in the literature, there's little argument. 30 years ago when I was first doing this, there were only a handful of studies tagged in with inflammation here and inflammation there, but it was beginning to get clearer to me, but it was certainly not dogmatic. But now there's literally thousands of studies on cardiovascular inflammation and the correlation with cardiovascular disease, and you would have to be pretty blindfolded to not see the evidence at this point. So I think what you should initially do is by stirring the conversation with the doctor. If the doctor is understanding, then you can move forward. If not, your doctor may have to grow a few stages in that process. You might get them, interested in some books that relate to it, that and metabolic disease, because metabolic disease plays heavily into this. The things that you put in your body do have a great effect on how this works, but how you exercise has a great effect on how this works. You can do a certain amount on your own, and then once you take charge of what you can, you do need your doctor's help for some of the remainder, and I hope you can find that physician.
Yeah, and sometimes you really have to go on a good hunt. There's a lot of cardiovascular doctors that really don't incorporate, advanced lipid testing, which blows my mind, and or the newest, latest, and greatest testing that is available, which is the MCG. Again, this is something I'm performing in the office. How did you come upon this test? What is this? What is this testing? Well,
when you teach all over the nation, you meet people, and I ended up making contact with Dr. Joseph Chin, who's the inventor of the multifunctional cardiogram. And for your audience that doesn't know what a multifunctional cardiogram is, this is a new technology that's been in development for 23 years, but it's only recently come to market. It's been on the market a little bit over a year now. There's just a few hundred of these machines in the country. So some states don't even have one, but some states have multiple. And what this is an electrocardiogram device that works on 2 leads instead of 12 leads, and it uses artificial intelligence. It uses a frequency domain rather than a time domain process, and because of that, it sees 26 things about the heart we've never been able to see before. Things such as small vessel disease that's characteristic or common in women, that's made it very hard to detect female heart disease. We can see it. It sees mitochondrial dysfunction. There's not a device on the market that sees mitochondrial dysfunction, but if you went through COVID and you saw people who were vulnerable to COVID, many of those who died were those people that had mitochondrial dysfunction. If you look at people who have large problems with insulin resistance, it usually starts with mitochondrial dysfunction. So you can look at autoimmune disease and cancers, and you say, I wonder how my relative had 3 cancers. It's going to tie in with mitochondrial dysfunction. Well, we haven't had a machine that would actually detect that, so we do now. We have a device that sees rhythm disturbances before they happen. So if you know a relative or have it yourself with atrial fibrillation, or someone that just went to sleep and never woke up with ventricular fibrillation, this device can see it before you get in trouble, and we can do something about it. If you look at the athletes that are succumbing to this cardiovascular issues of late, something's happened since we've had COVID. And between the disease and the vaccine and the various issues, now we're seeing athletes, young people, that are actually dying from cardiovascular events that I think are unnecessary, because this device not only sees early development of cardiovascular disease, but it sees early development of potential rhythm disturbances that are dangerous. So some of these young people, like the 17-year-old that just reported in Fox News that died, that was an athlete in Alabama, that was probably unnecessary. And so we need to get these multifunctional cardiograms everywhere there's an EKG. Now, most of your doctor's offices have an EKG. Every hospital has EKGs, ERs and such. So everywhere that has those needs to have a multifunctional cardiogram, because to be honest, it's the difference between college and kindergarten. Once you've seen a multifunctional cardiogram, you'll never go back to an EKG again because it's archaic. You'll say, I can't believe that we actually use that device when this is available. And so,
absolutely.
And going back to what you said earlier, how would you find a doctor that actually understands cardiovascular disease? Possibly doing your research and finding a doctor that either has a multifunctional cardiogram or a doctor who has access to advanced cardiovascular labs. If you went to a Cleveland Heart Lab, a Boston Heart Lab, or somebody and said, who in my area is running your test, they could give you an idea of who does that, who has a multifunctional cardiogram to the 2 multifunctional cardiogram companies. I think that would begin your journey of finding a doctor who would be well on his or her way to helping you.
Absolutely. And Bill and I together have been attacking San Antonio, South Texas, and even further up north, trying to get the word out about this exciting testing. It's FDA approved, over 2 million people studied. I mean, this is science exact as you can get it. And it blows me away that somebody like me, family practice wise, can take on cardiovascular disease by the horns and I want to say it outperform some cardiologists in their ability to test and reverse this terrible disease. Now I want to talk about, we're going to have.
While you're on that subject, can I say one thing?
Yeah, of course. Please.
Cardiovascular disease is not going to be treated in the cardiologist's office. And no offense if you're a cardiologist listening to this program. Cardiologists are only trained at treating 2 of the 10 inflammatory disease states. Family doctors and internal medicine doctors are trained to treat all 10. Therefore, if this disease is ever going to be fixed, it's not going to be fixed in the cardiologist's office. It's going to be fixed in the primary care office. So you should have a good relationship with a progressive primary care doctor that understands cardiovascular disease, and you can get out of trouble with this disease.
Absolutely. Thank you for backing me up on that, because I feel very, very passionate about this. And I really do think that we are on the cutting edge and the verge of attacking cardiovascular disease where it should be attacked, and that is right at the source. And so we do a lot of the advanced lipid testing in my office. I also do a lot of testing. You mentioned MTHFR, which I want to spend some time in our second half and talk about MTHFR, mitochondrial dysfunction, as you mentioned. This is very, very important. I think it's as important as insulin resistance. And so we'll spend some time on that. But as far as getting, testing in office, very simple, basically 7 to 10 minutes with the leads, attached to you, much like you mentioned the EKG. No radiation, very, very restful 10 minutes, very easy, no pain, no needles. It's performed by a technician, little briefcase box like an EKG. It's so simple. Insurances at this point do not cover it, but please do not let that deter you. You can spend a large amount of money in copays and, other testing like the Heart Saver CT and things like that, and spend, $600 to $6,000 on those tests that will not tell you anything near what the information I can give you in 10 minutes after, performing this test and reading it. Very, very simple in office. So we do those. And if you want to call the office, I'll have all my information coming up here in just a moment about how to find the office. And again, poor Bill Connor, the technician, is somebody who will travel some if he can and come to patients to get this done. So we're trying to widen the scope here. Dr. Fielding, if you mentioned the 10 disease state, and I know we got a break coming out, so it's kind of a quick discussion on those 10 disease states. You keep mentioning that over and over. Can you name those for us?
I sure can. The 10 disease states would include cholesterol. They would include diabetes and prediabetes, and there's an entirely large population of prediabetics that go undetected because doctors are using the wrong lab to pick that up. There is mental health disease, there's hypertension, there's chronic kidney disease, sleep disorders and sleep disturbances, genetics, autoimmune and leaky gut syndrome, as well as obesity. Those are the 10 inflammatory disease states. And the biggest ones of the bunch would include the prediabetes and diabetes. A lot of people don't realize that there's 3 of them that relate: the MTHFR, the sleep disorders, and the mental health. There's over 50% of the population that has that MTHFR genetic mutation. And so it's a 1 out of 2 chance that you got it. If you're listening to this program, you'll know it, because as you get about 25 years of age, you start not having the memory you used to have, and things start to irritate you more than they used to. And you tend to just stay a little fatigued. But by the time you're 50, all those things are heightened. That's why so many people take Prozac and Paxil by the age of 50, because they have an inability to break folic acid down to methylfolate. And without that methylfolate, you can't make the 4 chemicals you need in your limbic system, your brain, which is serotonin, melatonin, dopamine, and norepinephrine. So I hope your audience heard that one loud and clear. This multifunctional cardiogram picks up patients that have that in the advanced stages. It won't pick it up in the early stages, but it picks up so much more. It even picks up early coronary disease. Now, we've never had a device that ever would pick up disease early. Most of our testing devices are reactionary. They pick things up when they're in a dangerous place. But you can actually have a score between 0 and 22, and every year you'll know what your cardiovascular score is. You'll go in your doctor's office and get a physical exam. And when you get your blood drawn, you'll also get the multifunctional cardiogram that once a year or maybe more. And when that happens, you'll have a score like 1.2, and the next year you'll have 1.8, the next year you'll have 2.4. It's very clear to see if you're getting worse, because that number is getting worse. But if you went from a 2.4 down to a 1.0, that would suggest that whatever you and your doctor are doing is working. And that gives you some peace of mind. As long as it's not over 4, you know you're in a safe place. So there's a peace of mind when you go to bed at night. I'm not going to have a cardiovascular event. But now if your number's over 4, you can do something about it and get it under 4.
Absolutely. That is great. And so, hey, we are going to take a short break and come back on the other side. I want to mention Pinnacle Clinical Research, Pinnacle Research Texas. You can go to pinnacleresearch.com and get your free FibroScan for fatty liver. I have to throw that in. The Pinnacle has been a wonderful supporter of me. So we're going to come back on the other side and talk a little bit more about MTHFR.
Fatty liver is linked to 2 different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. I'm Dr. Mariane Pinkston here with Dr. Sam Fillingain, and we have been talking about cardiovascular disease and so much actually, and the MCG, multifunctional cardiogram, which is a fantastic test that is revolutionizing the treatment and finding cardiovascular disease and preventing the number one killer in the United States. So we were talking a little bit about MTHFR, and maybe I can give you a setup of what this patient looks like, because I was this patient. I think this is probably about 80 to 90% of the people that I see. Fatigued, just feel like you're running on adrenaline all the time. Brain doesn't really work. You have brain fog, but you also just can't concentrate, can't find that word, can't finish your sentence. I call it brain stammering. The inability to get up and go, losing your motivation. You were describing it beautifully. I'll let you take over from there, but this is a lot of people I see.
No, I think when people get about 23, 25, they don't realize that their memory's going, and they're trying to get their career started, and it's just not going for them as well as it should, because they're getting a little forgetful, and they're getting words trying to come out in a meeting, and a word that they know regularly use, they can't get it spoken. And then they get a little older and they start getting more irritable, and they go home and their marriages start having a problem because the things that used to not irritate them now start to bother them significantly. They become more introverted. They actually may even go to the other side of the house from the spouse, but sometimes it's not that bad. But what will eventually happen is you'll get about age 50, and everything that you used to enjoy doing, you just stop enjoying. And that's the characteristic philosophy of MTHFR genetic mutations. There's two of them, a 677 and a 1298 mutation. They're both treatable because they're related to an enzyme that you have when you're born, but as you age, you start to lose the ability to manufacture that enzyme. Well, once you can't manufacture that enzyme, it's called methylene tetrahydrofolate reductase. That's what MTHFR stands for. Well, you can't break folic acid down to methylfolate, and there's brain chemicals that we just mentioned that are important to that. And there's also a chemical called nitric oxide, and that has to do with your cardiovascular health. Nitric oxide is basically the firefighter of your cardiovascular inflammation system. And I just spoke about the importance of inflammation. If you have no nitric oxide in your system, you're basically going to age a day and a half for every day you live. So if you're a 50-year-old person, you might technically be 65 years old in that body, and nobody wants to be a 65 or 70-year-old in a 50-year-old body. But now that's kind of true for anything that destroys mental health, and that could be anything to do with the substrates or the factory. Sometimes it's a sleep disorder, sometimes it's the methylfolate issue, sometimes it's a lack of fish oil and omega-3, sometimes it's a lack of something else like vitamin D. But when you lack the substrates, or when you lack the sleep mechanism, you'll not make these chemicals in your brain, and then you have those struggles. But then you have the nitric oxide deficiency with this MTHFR, and that further amplifies things, because patients then can't stop this aging process. Plaque just starts building up incredibly fast, and everything just goes to pot. You look at your skin and it gets thin, and you start saying, oh, what's happened to that? And then you realize that same skin is causing leaky gut issues because you're losing collagen in both places. The brain fog is coming from the MTHFR, it's coming from the leaky gut. You think it's just because I'm getting old. But these are things that you don't have to accept. In fact, nowadays, there's enough technology out there. If you don't want to get old fast, you can actually turn the clock around. You could be a 40-year-old in a 50-year-old body, and I think that's kind of where we're moving. The progressive doctors that understand cardiovascular disease also understand anti-aging. And I would encourage you to discuss that with your doctor if you don't want to age the way I spoke of earlier. You don't want to be that older person in a younger body. Fight this and protect your marriages, protect your career. I mean, it's terrible when you get 50 years old and someone tells you something 3 times and you hadn't remembered it. It's strictly a methylfolate issue a lot of times. You get the right dose of methylfolate in, and that fixes things. What some people don't realize, if you have no serotonin in a serotonergic nerve, you're firing on adrenaline. So your body has to circulate large levels of adrenaline 24 hours a day, 7 days a week. And that high level of adrenaline.
Living on gas fumes. I say living on gas fumes. That's what I tell people all the time. It's what it feels like. It's
the equivalent of drinking 4 to 5 Monster energy drinks a day. And I think most people would know that's not a healthy practice.
No. And still do it. But Well, Dr. Fillingang, we're coming up on the last 2 minutes here. This has been an extraordinary amount of information for people. I thank you so much. It's what you've done in this 27 minutes you've done for me over the years, and it's just been wonderful, and I thank you for that. You've helped me personally, too. I have MTHFR, and it was a huge discovery for me to understand what this really meant. I heard it in medical school. I heard it at, A4M, but I did not understand it until I was afflicted. So you have helped me, and I really appreciate that. I do want people to know I've got a lot of information that I'm going to have available on my website. So please go to drpbetterlife.com. You can find tons of information about my social media, but also all the podcasts. We've got, I think, almost 150 of them now for the last couple of years. And YouTube, iTunes, Spotify, all the platforms are represented. So you can go to any of these and find information there. Also, I'm on San Antonio Radio at 4 p.m. on Sundays. Well, please listen in to AM 930 here in San Antonio, local South Texas. And I will have more information as well on Dr. Fillingang so that you can find out more about him and his studies. He's got a huge life poured into this topic and has been great at educating so many. And again, Dr. Fillingang, we really appreciate you. Any final thoughts as we turn it off today?
I hope everyone here will have taken care of their cardiovascular health. There's two big things you can do on your own before you even reach your doctor, and that's cut your carbohydrates down to less than 25 grams every 4 hours and exercise aerobically 50 minutes a day. That's 50 nonstop. If you'll exercise 50 minutes a day nonstop, you can probably remove 93% of the inflammation that comes from your circulatory system in one day. It comes back tomorrow, but you just do it every day. I exercise 7 days a week for a reason. I don't want this cardiovascular inflammation in me, so we get rid of it.
You're probably the healthiest guy I know. Awesome. Well, Dr. Fillingang, thank you. I hope everybody has a wonderful week, and we will talk again next week. Join in, drpbetterlife.com.